Hi, my name is Delaney Hickok, and I will be doing my investigative presentation on the Gore cardioform septal occluder. In my presentation, I will be covering four main topics. These topics are: what is the history of ASD? What is the Gore cardioform septal occluder? Is this device covered by insurance? And how much does it cost? And lastly, patient experiences. Atrial septal defect, or ASD, is defined by the Mayo Clinic as a hole in the heart between the upper chambers that can damage the heart and lungs. This defect is caused by a failure of foramen ovale closure in a baby's heart. This is a hole between the two atria. In normal individuals, this hole will close soon after birth. This allows for deoxygenated blood to be separated from the oxygenated blood. ASD has been known to cause a large variety of issues, both in infant and adult life. These issues include ischemic strokes, heart murmurs, shortness of breath, right-sided heart failure, and difficulty breathing. According to the Mayo Clinic, a large atrial septal defect can cause extra blood to overfill the lungs and overwork the right side of the heart. If this is not treated, the right side of the heart eventually will grow larger and will become weak. The blood pressure in the arteries in the lungs will also increase, leading to pulmonary hypertension. This defect is most common in women and affects 1 in 5 people. However, many people are unaware of this defect due to lack of significant issues. So how can we fix this birth defect? We can fix it with the Gore cardioform septal occluder. This device is a permanently implanted device that will close the hole caused by the failure of development. It is comprised of 2 discs with 5 petals. According to the manufacturer, these petals allow the device to conform to the anatomy to treat simple to complex defects. EPTFE, which is a biocompatible material that enables exceptional conformability and rapid tissue growth. And lastly, minimal use of metal wires designed to reduce the risk of tissue growth. And lastly, minimal use of metal wires designed to reduce the risk of tissue damage. There are 3 different sizes used to best fit the hole. These sizes include 20, 25, and 30 millimeters. This device was developed by Gore Medical, a team that has been creating medical devices for over 40 years. This device has a 99% effectiveness of closure across anatomies, as well as 0% erosions and a 69% reduction in relevant strokes at the 5-year mark. In similar devices on the market, the use of large amounts of metal has caused challenges, including the erosion of septal structures and tissue damage. This device uses minimal metal in order to minimize these issues. In order to eliminate the possibility of nickel poisoning or allergic reactions, this device is made of platinum-filled nitinol wires. This allows for minimal nickel elution and exposure. There are currently 2 devices approved by the FDA for the closure of the foramen ovale. These include the Gore cardioform septal occluder and the Platzer PFO occluder. This video shows how a Gore cardioform septal occluder is being placed. This is a human heart with an atrial septal defect. The catheter is placed through a vein or an artery that goes straight into the heart. The catheter releases one side of the device and pulls it flush against the heart. Then releases the other side and pushes it flush to the other side of the opening. A metal hook then clips the side together and the device into place. This is the placed Gore Cardiogram septal occluder. Over time, tissue will form over the device to further close the hole and ensure the device's placement. According to cardiac interventions today, since the FDA approval, private insurance companies have changed their coverage policy to include devices such as the Gore Cardiogram Septal Occluder. The exact price for this device is not listed due to confidentiality. However, similar devices cost approximately $5,000. The procedure for placement ranges in price approximately from $8,000 to $33,000, as well as a possible additional $6,000 to $25,000 for closure complications. In order to enhance possibility of coverage, these are the qualifications that are asked for by insurance. Prior authorization submission should be accompanied by a clinical encounter that contains all of the following: a description of the cardiac imaging confirming the presence of PFO, description of the cerebral imaging identifying a stroke or multiple strokes, and mentioning the likelihood that it was embolic in nature, a notation that the patient was evaluated by a neurologist and a cardiologist that both agreed that PFO closure is reasonable to prevent a recurrent event, a calculated ROPE score, the results of a cardiac event, monitoring, documenting an absence of atrial fibrillation or atrial flutter, and lastly, a description of the tests performed to exclude other causes of ischemic stroke. The reason I chose to research this topic is because my dad had this device put in last December during months of severe headaches. He went to the doctor and they did imaging of his brain and found that he had had multiple strokes. They did more imaging of other parts of his body and found that these strokes were caused by an ASD in his heart. I interviewed him on his experience during the procedure and life after, as well as just the changes that he has noticed over time. So, during the procedure, he was put under general anesthesia. However, it wasn't stressful for him because they gave him because the general anesthesia calmed him down. They placed the device delivery catheter, an imaging catheter, on either side of his groin. They went through the veins in his groin up to his heart. He said that he didn't feel any pain in the procedure or after the procedure, both in the groin or the chest. However, there was a lot of bruising in the groin post-procedure. He said that there have been zero negative side effects other than a fever for the first 48 hours post-surgery and a rapid heartbeat that occurred 72 hours post-op. He has felt calmer and less agitated and has been able to breathe easier and has no discomfort to this day. Overall, his symptoms have been reduced and he feels healthier overall. This is my list of references in alphabetical order as well as in APA format. Thank you to SlidesGo for the presentation template.